Hello, good morning.
Good morning.
Morning.
I'll just give you some, at least like. So really all of that. I know you all. So. It's always. Yeah, to do something. Yeah. So. All right, I'll try to remember. If not, shoot me a text too, because Emily always has some generally handy. I'll grab it.
Welcome, everyone. Sorry, I'm running a couple minutes late from another meeting. We'll give folks another minute to join, and then we'll get started. Okay, we'll give folks 20 more seconds, and then we'll get started. Okay, welcome, everyone. My name is Kathy Kilrain Del Rio. I use she, her pronouns. I'm with Maine Equal Justice and also chair this committee. Sorry, I'm just catching up on a few chats from people. We usually start with introductions, first with MAC members and alternates, and then we'll jump over to main care folks, and then we'll jump back to any main care members and alternates we missed, and then guests. And there's a couple folks who aren't able to be here today or who have to leave early, so we'll try to make accommodations as necessary for those things. So we'll go ahead and start with introductions. And the way we normally do it is I will read the list of names and you will say your name, your pronouns, and your organization. And we'll start with Miriam Bashir. Norma Desjardins. Catherine Brandt. Jessica Drenning.
Hi, good morning. Jessica Drenning, she, her pronouns. I work for the Department of Health and Human Services with the Office for Family Independence.
Jamie Bork. Or Eric Fromberg. Nilsa Ayanle. Mallory Shaughnessy. Or Suzanne Farley. Kathy Dion.
Hi, my name is Kathy Dion. I'm with the Autism Society of Maine. I use she, her pronouns, and I also am a parent of a consumer.
Thank you. And Nilsa, I see you there now. Do you want to introduce yourself?
Hi, my name is Nilsa Ayanle. I am from Westbrook. I'm a mother of 3 and I do interpreting.
Thank you. Becca Matasovich.
Hi, Becca Matasovich with the Children's Oral Health Network of Maine. She, her pronouns.
Vicki McCarty.
Hi, Vicki McCarty. I'm with the Consumer Counsel System of Maine, and I'm a person with lived experience of mental health issues. And our organization is made up of people with lived experience, and we represent other folks who have lived experience of mental health issues. Thank you.
Rachel Collmore.
Good morning, everybody. Rachel Collmore at Consumers for Affordable Healthcare. She, her, hers. I don't think does anyone need an explanation of what Consumers for Affordable Healthcare does? I think it's been a while, but we are the consumer assistance program. We help individuals across Maine navigate and enroll in the various health coverage options available to them.
Thank you. I think Sarah Squires is not here today. Is Atlee Riley? And Gia can't be here, but I believe Izzy Ostrowski is.
Hi, everyone. Izzy Ostrowski. I use she, her pronouns. I'm the Network for Older Adults Coordinator at Equality Maine.
And I see Mallory Shaughnessy is here now. Mallory, do you want to introduce yourself?
Sure. Hi, I am Mallory Shaughnessy. I use she, her pronouns. I am the outgoing executive director of the Alliance for Addiction and Mental Health Services, current vice chair, hoping to see a new vice chair today, and chair of the provider subcommittee, also hoping to find a new chair for the provider subcommittee today. Glad to be here. This will be my last meeting, so it's lovely to see you all.
We will miss you, Mallory. Susan White. Or Lori Belden. Catherine Hamilton. Leo Delicata.
Good morning, Leo Delicata, he, him, Legal Services for Maine's Elders.
Sarah Lewis, Laura Cortez,
Good morning, all. I'm sorry to be joining from the road today and off camera for a bit. I'm Laura Cordes, she, her pronouns. I'm the executive director of the Maine Association for Community Service Providers, MACSP.
Rachel Dyer, or Nancy Cronin, David Winslow, Ann Sedlak,
Hi all. I use she, her pronouns. I'm the director of advocacy at the Maine Medical Association.
Bobby Martin,
Hi, Bobby Martin, Director of Community Health Innovation for the Maine Primary Care Association. I use he, him pronouns.
Candy Henderly,
Good morning, Candy Henderly, Director of Health, Penobscot Nation, she, her, hers.
Teresa Cochran, or Kristen Goddard. Is there anyone else who's a MAC member or an alternate here for someone today who I missed? Okay.
Hi, Kathy. I don't know if I came on a little bit late because my computer was being worked on, but Adam Bloom Picopoulos is here, and he is my successor who will be representing the Alliance on the MAC moving forward after this month. So I wanted to just highlight that to give him a moment to say hi.
Sure, go ahead, Adam.
Awesome. Thanks, Mallory. And hi, all. I'm Adam Bloom-Pykopoulos. I'm taking over as the director of the Alliance, as Mallory mentioned. I use he, him pronouns, and I'm down in Wells, Maine normally. So it's great to meet you all.
Welcome. Let's jump over then to Maine Care members, and I see Michelle is here. So Michelle, I'll pass it to you first.
Thanks, Kathy. Good morning, everyone. My name is Michelle Probert. I use she, her pronouns. I'm the director for the Maine Care program, and nice to be more on time than I usually am this morning. And nice to see you all. And I will pass it over to Molly Slotsnik.
Hi, good morning. Molly Slotsnik, Chief Operating Officer, Office of Maine Care Services, she, her, hers. And I will pass to Kayla.
Good morning, everyone. Kayla Sargent, she, her, hers. I am the Director of Strategic Planning and Communications here at the Office of Maine Care, and I will pass it over to Courtney Platson.
Good morning, everyone. Courtney Platson, she, her, hers, Maine Care Medical Director, and I will turn it over to Jessica Miller. We can't hear you, Jessica. No. I'll turn it over to Becky, but we can't hear you, Jessica. I don't know. I can see you unmuting, but it's not working.
Hi, I'm Becky Parsons. Becky Parsons, I'm the EPSCT coordinator. And I don't know if Jessica is ready, but I can pass it to Sana.
Good morning, everyone. I'm Sana Osman, Member Engagement Manager at the Office of Maine Care Services, and I'll pass it on to Sarah.
Good morning, everyone. I'm Sarah Fisher. I use she, her pronouns. I'm the Maine Care Outreach Specialist for OMS. I'm taking a look at our, if there's anyone else from OMS, go ahead and jump on, but I may be the last.
Hi, Lisa Weaver, Office of Maine Care Services Policy, she, her, hers, and I'll pass it to Kristen Merrill.
Thanks, Lisa. Kristen Merrill, State Plan Policy Development Manager for OMS Policy, she, her pronouns, and I'll pass it over to Mandy.
Thank you. Amanda Lee, Rate Setting Coordinator at Maine Care, and she, her pronouns. I think that's it for OMS stuff.
Thanks all. And I see that Miriam Bashir is here now. Do you want to introduce yourself, Miriam?
Yeah, I did send a brief introduction in the chat. I'm a public health student at USM, and I use she, her pronouns.
Are there any other MAC members or alternates who got missed? I see that some guests have already introduced themselves in the chat. If you haven't yet, you are welcome to, or you can take yourself off mute quickly and introduce yourself. Okay, let's go ahead and jump in. Oh, go ahead.
I'm Melissa Bliss. I'm with Maine Site, which is the state's assistive technology program. Previously, Jesse Wright was on the committee, and it's been reassigned to me. So nice to see everybody.
Welcome. Let's go ahead and jump into the agenda. We are going to kick things off with updates from OFI, and Ian's not here today, so Jessica is going to do those.
Hi, good morning. Yeah, so I'm going to cover some quick updates for OFI on behalf of Ian. I think one of the first things we wanted to discuss was just a quick update on unwinding. We are still on track as expected for kind of our first group of renewals to go through at an individual level starting next month, which is something that we've been waiting for and kind of kicks off into our big months of August, September, and October, being kind of those last months to wrap up the population that needed to be reviewed. So we will have, I think the number that we've settled on is around 52,000 members that we're expecting to reschedule for those months to wrap up their renewals. We also, anticipate, these are, again, just as a reminder, folks that have been contacted maybe multiple times, sometimes 3 times throughout the period of unwinding to complete a renewal and have not yet responded to those renewals. So this is kind of our last push and effort. So this is a time where those kind of procedural denials will start happening for anyone who does not return the renewal within that window. There is going to be another partner briefing about unwinding that's happening towards the end of June. And we can provide more details then about maybe who will be coming in those months, the pending population. But there's a lot of work going into kind of looking at the demographics, how to target people to make sure that we can get renewals back from that population. And there will be a Zoom link coming within the next week, which I believe Ian plans to share with MAC members. And the MaineCare renewals data dashboard should also be updated this week through the end of May of 2024, and I can shoot the link to this chat in just a moment as well. That was pretty much the unwinding update, and then if anyone has any questions on that, happy to take them. I see one.
I think Rachel.
Yeah, thank you. So Jessica, just to be clear about the ex parte starting in July. So is July are you going to be doing ex parte at the individual level for consumers, or sorry, for members who you are able to use that process on for annual renewals that are due in the month of July? So short version, are you going to kind of start those in June, and those renewals will be ready for July?
Yes.
Okay, excellent, awesome. So we can expect that that members who were either renewed ex parte or did not complete a renewal in July, that group is going to be part of this new kickoff for those for the terminations and procedure and yeah, okay,
yeah,
awesome. Yeah.
And it's a good question, because I think what you're going to see, you're going to start to see the changes, clients, consumers, everyone will start to see the changes with noticing potentially immediately, in June for July renewals, because it's potential that households could have some members that are able to be passively renewed and go through the process without a problem. So they're going to be noticed of that, and then they will also potentially be receiving the renewal at the same time or within the same week, which tells them, we were not able to complete the renewal for member A, member B, member C, and you will need to complete the renewal for them.
Jessica, that's super important. I hadn't really thought of a scenario where some members of a household would get that ex parte renewal, but others would still be getting either the blue envelope or a notice in their MyMean connection. So thank you so much for pointing that out. That it's one of those details that when you're trying to navigate so many things in this really complicated problem, I
Yeah,
wouldn't
for
have
sure.
thought of. So thank you so much for pointing that out.
And we tried to, align the timing as best as we could for the messaging for everybody. So I'd say within about the same week, the mail should be arriving regarding both. It was not possible to get it all at once, but we did as best as we could to kind of align it. It's something we're looking at for future enhancements as well. If we're good on unwinding, I can move on to our second update, which was regarding the MSP buy-in changes as well.
Jessica, I was just going to ask if you can explain what ex parte is.
It's just that they're renewing without having to submit any additional information to us. So we're using data sources that we have available to us to check the income information that we have, and we're trying to make it match. And if it's reasonably compatible or matches within a certain threshold, then we're able to renew them without needing them to provide additional information to us. So it really saves time for the client and it saves time for the department. It's a reduced administrative burden for both parties. And really the way that CMS is going forward with kind of renewals for everybody, they would like us to do it for as many people as possible. And that's our goal as well. There are some instances where we do need additional information from clients to complete their.
I don't know why everyone calls it ex parte because it's a really unhelpful, non-intuitive name. Passive renewal is slightly more helpful, but still not the greatest. So thank you for asking that question.
Yes, for sure. Okay, so the other update to provide from OFI is just that we are going to be moving forward with the FPL increases for July 1st for the buy-in population. So Quimby is moving from 150% of the FPL to 185%. QI is going from 185 to 250% of the FPL. And this effectively eliminates SLMB and Maine as they're now kind of absorbed by the Quimby population. So the proposed rules are published and there's a comment deadline on those rules of July 1st. Current MSP members who will now qualify for that higher level, so current SLMB and QI members, we are going to be automatically converting their coverage later in the month of June with a July 1st effective date. I think the timing of that looks like right now around the 21st of June, and we'll be sending a letter to consumers at the same time. So for anyone who's already familiar with the letter that people receive when they get on Quimby, it's very similar to that letter that they were previously receiving. That is kind of their card. The letter has always kind of also served as their card and notification. This one-time letter for all of those people that were switching will also serve as that.
Jessica?
Yeah.
I'm sorry, but I know we've talked about Medicare Savings Program before, but could you just, as you're saying these acronyms for like Quimby and QI and SLMB, can you just say what they are?
Yes. So Quimby is the Qualified Medicare Beneficiary Program, and Qualified Individual is the QI program. So those two are the two that will remain. And both of those programs help with paying the cost of Medicare copays. The Quimby program is a better benefit in that it helps pay for the cost of the Medicare, deductibles, co-insurances, co-payments. People shouldn't be incurring those fees anymore once they become a Quimby member. The difference between Quimby and QI, besides some of those co-pays and co-insurances, is also that we cannot retroactively grant a Quimby benefit for anyone. We can do retroactive on QI or qualified individual benefit, but both are Medicare Savings Program benefits that help pay for the cost of Medicare premiums. And let's say, I don't know if anyone has additional questions about any of that, but happy to answer them.
Kathy? Kathy, we can't hear you.
Is this better?
Yes.
Oh, good. We have a large team at Maine Health who help people apply for these types of programs. And we're trying to move from paper to My Maine Connection. And one of our case managers, after the relaunch of My Maine Connection, allowing assistants to do that a little bit more easily on May 13th, we tried to apply for the Medicare Savings Program, and sort of a hurdle comes up where you have to put in the asset information and you can't proceed with the application until you provide that information. And so I did reach out to Liz Ray, but I just wanted to raise that as, you know, we would love to move to more online, but that is a hurdle for people because if assets aren't included in the decision, to have to put in that information on My Maine Connection where you don't have to do it on the paper application is a little bit of a barrier.
Yeah, Kathy, it's a good point, and it's something that we have discussed internally. The way that our online application works at OFI, it kind of takes people down two paths when they're going through that, and it's, you know, kind of a magi or like family related path, which assets wouldn't matter, and then a SSI related or an elderly and disabled path that assets are a question for a lot of those programs. And now that there is no asset test for the MSP program, we know that potentially, you know, individuals, they don't need to necessarily include all of that information in order to fully submit the application. There is, I believe the way that it works is it asks the question, do you have assets? If you say yes, then it requires the questions. If you say no, it does not require the questions. So not that I'm encouraging people one way or the other, but I'm just letting you know systematically kind of that's how it works. I would say that if it's not too much and they fill out those steps, that if people are willing, that is ideal. But if not, then we understand that too. And the option would be to say no, and those questions won't jump.
Thank you. Very helpful.
I'm just going to say, I think it's problematic to encourage people to select no if they do have assets, because I think a lot of people will feel uncertain about if that's accurate. And I think the other problem would be if somebody didn't know if they're getting MSP or if they might actually be eligible for full Medicaid, and then they said no because they thought they could only get MSP, but it turned out they were eligible for full Medicaid without assets, but their assets would have put them over the limit, then they would be incorrectly providing information to the department about their eligibility. It feels like, I know technology changes are always a challenge, but like adding some sort of box that allows people to say, I'm only applying for MSP or something like that would help bypass that without people providing incorrect information to the department.
Yeah, I 100% agree with you, Kathy. And it is something that we have discussed here. We do quarterly technology deploys on updating that system, and it's something that has logged for a change on our side, because 100% agree with everything that you said. I would not encourage people to not disclose information that they already knew to be true. And I do think that you're right. There's potential for screening for a lot of eligibility options. Applying for the buy-in only, MSP only, is a choice through the iOS application. So that part is already implemented. It's just we're looking to make some changes around the asset questions for specifically MSP. So don't know exactly when we can work it in time frame wise, but it is something on the radar that we're hoping to work.
Great.
So just to clarify, Jessica, are you saying, so there is a box that you would say I'm only applying for a Medicare Savings Program, but it would still ask you those asset questions
It would
currently?
still ask you the question, do you have assets? And if they say yes, then the asset questions will generate.
I wonder
Jessica,
if you
you're
could just
dropping, the sound is dropping a little bit at the end of your sentence. Could you just repeat what you just said?
Yeah. It will ask if they have them, and if they have them and they say yes, then it will require answering the asset questions next. So it's kind of like a phased question. Like if you say no, you go one way. If you say yes, you go the other. And if they say yes and answer the question, then it will require the F.
Rachel?
We've noticed that just because, OFI is trying to feed as many birds with one seed as possible with their applications, that we find that sometimes we have to answer yes to questions that we know won't necessarily impact their eligibility for certain programs. So we, especially when we're trying to help consumers navigate the MaineCare application, like, let's say they're applying for both MaineCare and SNAP, right? Like some income counts for some programs and some doesn't for others. So we're just trying to do a lot of education beforehand and making sure that consumers aren't going to panic and say, wait, I thought this didn't count. And just being like, oh, you have to answer the question, but, it doesn't really impact your eligibility for it. It's just that in our experience, the application is trying to screen for multiple programs at once. Some may count assets, some might not, some might count this income and not count that one. So we appreciate that you guys are trying to do as much as you can with one document, but I do want to, Kathy's correct, it can cause some confusion and anxiety for consumers who are trying to enroll.
Karen, can I ask a question? Because something that OFI has tried to do is employ the use of kind of those hover boxes where sometimes if you hover over a question, it will provide additional information in some of those scenarios where we kind of try to explain, like, this is maybe why we're asking, or this is, this will not impact this, but will impact another. So if you all see any opportunities where maybe additional hover windows or pop-ups would be helpful, please feel free to share that information with us, because those are, I don't want to say that anything is an easy technology fix, but it's definitely on the easier end of technology fixes that we could get into the system more rapidly than some of the larger changes.
Thanks, Jessica. And also for those of you who might occasionally help people with applying, but not all the time, Kathy Pipkin mentioned this, but if you have someone who's like going through the process online and you get stuck with like the asset question, it's not relevant to their circumstances, an option always is to print an application and do the print application, just leave the asset section blank or say this isn't relevant. And you can bypass things more easily on the paper one. And you can also write in things if you need to explain why you're skipping it. Which is not ideal. Ideally, we want to make everything easy in both manners, but just for folks who are less familiar, there is an alternative if you need it. Anything else, Jessica?
I think that's all that we had for today. Thank you.
Any other questions for Jessica? Rachel?
Yeah, I just want to make a quick plug too for our organization. If you're not used to helping consumers complete a MaineCare application, which many of you maybe are, but if you get hung up with something, we are a resource too. So if you need to call us and ask us some questions, most of the time we're a little bit easier to get a hold of than asking an eligibility specialist. So we're happy to be that resource for anyone who's trying to navigate that and is short on time. I'll drop the number in the chat. I also dropped a link to our MSP flyer for anyone who might be curious about. It just kind of simplifies like what's covered and what's not. And if anyone from the department notices any errors on that, we'd love to hear from you guys. Thanks.
Thank you. Next up on our agenda is communications updates. Kayla?
Thanks, Kathy. Hi, everyone. Just a couple of communications updates from MaineCare today. I would like to announce that Sarah Fisher has officially kicked off our summer outreach effort. She has so far attended the Farmington and Brunswick farmers markets, but if you see her out this summer at your local farmers market or any other community events, please feel free to go up to the table and say hi. Also, we will have a formal summary toward the end of the fall to give you all a report back on some metrics of success and the overall results of our outreach this summer. So looking forward to that. And then I'd also like to share that Sanaa Osman recently had a lot of success with member engagement. She shared a survey via a bunch of community avenues and also our e-messages targeted toward members and family members and previous MaineCare members. And she received 8,352 responses, which is a huge success for us. We're still digging into the data, so no results to share in terms of our provider directory and the top we were surveying about, but we are thrilled to see that level of engagement. And we think it's promising that it will feed into our efforts to put together a beneficiary advisory committee. So thank you, Sana, and thank you, Sarah, for your efforts. And that's it from communications. Any questions about communications topics or efforts?
I don't see any. Thanks, Kayla.
Thank you.
So next up is updates from MaineCare, and I'll pass it back to Michelle.
Thanks, Kathy. So we have a late joining guest this morning from MaineCare, who is going to provide some exciting news. Liz.
Hello, everyone. I am Liz Remillard. I work with Michelle and others here at the Office of MaineCare Services as the Certified Community Behavioral Health Clinic, or CCBHC program lead. I work with a cross-office, cross-department team from the Office of Behavioral Health, the Children's Behavioral Health Services team as well. And we have some exciting news that the federal SAMHSA, so the Substance Abuse and Mental Health Administration, and the Centers for Medicare and Medicaid Services has designated Maine as a CCBHC demonstration state, which is a huge accomplishment for us and really huge opportunity for the state of Maine to implement CCBHC as a model in the coming year. And just to give all those who maybe are like, what is CCBHC, and give you some context, the Certified Community Behavioral Health Clinic model is a similar model to the federally qualified health center primary care model, where it's intended to expand access and no wrong door approach to behavioral health care and offer a safety net in our communities to accessing behavioral health care. So we're really excited to be able to expand access to behavioral health care with a set number of providers over the next year who have been engaged with us in this partnership and are just really, really excited about this opportunity with this federal designation.
Thanks, Liz, for sharing, and congratulations to Liz and her team and partners at Office of Behavioral Health, as well as all the community partners who've been helping us with this effort. We're really excited about it. I think the only other brief update I have is just because I know that there's a lot of interest in this work, and we've collectively been waiting for a while. We are going to be shortly sending out an initiation notice for the rate determination process for, Kristen, do you have a more official name that I can use than the shorthand one we've been using? I don't want to no. Okay. So this, informally, we have been calling this our home and community-based services, clinical and nursing services rate determination. I will say that it's a little bit broader than that. Also includes, I think, some care coordination activities. It's a broad scope, and we've also recognized that some of these rates are certainly overdue for updating, and we want to make sure that we are providing rates that are sustainable. We know that there are access issues related to nursing services in the home specifically. So this covers many different sections of policy. We have been meeting, we were working on contract finalization, and then we've met internally with the vendor to make sure we're on the same page, but are going to be engaging publicly shortly. So I wanted to let folks know. Kristen, would you say anything else about that?
Just elaborate on some of the service descriptions for the services that are included. So as Michelle mentioned, nursing and clinical, generally speaking. We also are including therapeutic intervention type services, physical therapy, occupational therapy, etc. Supportive skills building, assistive technology, devices and services, and care coordination services, as Michelle already mentioned. And I can drop a list of sections of the benefits manual that will be included. It is articulated in the message that Michelle is referencing, but I'll include it in the chat for folks as well.
Great, thanks for that additional detail, Kristen. And for those of you who are like, wait, didn't they just update rates for speech PT and OT? couple of years ago, the answer is yes. However, historically for the non-home-based therapies, we have benchmarked those rates to Medicare, but those services provided in the home have not been paid in the same manner. And part of this rate determination effort is to assess the services that we're looking at to see, is there a reason why we should not also benchmark these same services to Medicare? Is there something different about these services or not? So that's part of the scope of this work. And I think that's it for my updates this morning. Thanks.
Thank you. Any questions? Okay, so Laura Cortez, I just am checking with you. You wanted to flip the order, right? With the rates and providers. Does that still work for you, or are you traveling still?
You know that I am still traveling and I have till about 11:15. So we certainly could keep the original agenda.
All right,
Thank
well then
you.
we'll stick with that. Thank you, Laura. So provider subcommittee, Mallory, do you have updates?
I do, and I sent the minutes out to the list of folks, but I can give a couple highlights here. But while I'm actually doing that, I am seriously looking for a new chair for the provider subcommittee. If there is a provider member of the MAC that is interested in taking that over, that would be great if you could reach out to me. If I find somebody before the end of this month, I will transfer the list of folks that have been attending to them and kind of hand over the reins. But if not, I'll give it back to somebody at OMS, and we'll have to seek somebody later on. So please do get back to me if you are interested in taking that over, and I will put my email in the chat here. So for the last, yeah.
Can I add one thing to that? Kayla and I were talking yesterday, and Kayla had a good idea around, so for folks who haven't been around as long, under the rules, the subcommittees are supposed to be chaired by MAC members, but they don't, but anybody can be a member of the subcommittee. You don't have to be a MAC member to be a member of the subcommittee. But we were wondering if it might make sense to try to have vice chairs for the subcommittees too, so that in a circumstance like this, we'd have a backup person. And maybe it might be okay for the vice chair to be someone who's a member of the subcommittee, but not a member of the MAC, because it would be like a temporary fill-in, not an ongoing fill-in. So I'm throwing that out there just in case there's someone, hopefully there's a MAC member on here who is associated with providers who would like to chair the committee to keep that important work going. And we need that. But in the short term, if there were another member of the committee who is a provider who goes to the meetings but isn't a MAC member, or isn't a MAC member any longer, because we had some shifts around that in the last couple of years, you could be the vice chair, and then we can continue to try to get a MAC member to be the chair over a longer period of time, just so that that committee can continue to meet and do the good work it's doing.
Great. So we will see who we can find, and if not, I will start like knocking on doors. So for the last meeting, we talked about continuing sort of issues with the Evergreen and the transition there. There was an ask of the department to potentially put together an FAQ or guideline of some kind on some of the individual troubleshooting that's happening. The individual troubleshooting is good, but some sort of an FAQ to sort of pull those all together would be helpful. We talked about e-signature many providers are moving into a very, electronic world, electronic health records, electronic everything. There's still some conflicting guidance in Chapter 1 and in MaineCare around e-signature acceptance. And I understand there's some internal conversations around that. So just know that that's, providers are hoping to see something with more clarification to come out on that in the near future, if possible. We discussed Gainwell doing trainings that are coming up, and I've actually got, I can set this in the chat here. I'll do it after I'm done. I can't do it while I'm talking. But there's trainings coming up with Gainwell. I'll put that in the chat. And then continuing discussion around the service provider tax and awaiting the list of sections. I know that is coming. I don't know if Michelle has an update on that specifically. I don't think so.
I'll just say, Mallory, I was hoping to be able to give a time frame today for having the additional detail, but a key staff person has been out on vacation and is back, and we're connecting with them this week. So more to come soon, but we will have a time frame soon and are working on FAQ and the details.
Great. Thank you. There was some continuing conversation around the rounding rule and issues there. And a request was submitted to the department through Heidi and folks at the meeting to understand where the research or where the reasoning for the rounding rule that we have now came from. We'd love to see sort of what the rationale, why we are there. Providers are continuing to have some real issues with that. One specific group of med management, which is an issue or a service that we need more of and not less of. But clinicians are struggling with the reporting based on the rounding rule as it stands right now. And I know KBH has been working with Bill Logan and Deb Poulin in the department around that, but it's really having an impact on the clinicians, and they are fearful of losing some of their providers due to the complexity of it and the issues around it. So just putting that out on the table, that is just one example. Many providers are struggling with it still. Those were the main issues that came up at the provider meeting. It was also requested to, I know there's a lot of shifting to value-based payments and alternative payment systems, which we're very supportive of in many ways. There's some concerns around the HCT continuing, some continuing concerns around the home and community treatment transition to value-based payment with a 4% withhold. And request was made to understand what the research is behind that, because that seems a large amount and we didn't find any other examples of that. So we would just like to get some more information on that. And our next meeting is on June 25th at 4 p.m. I can drop the Zoom link in there. And that's pretty much it. The minutes were shared, and they'll be online. So that's it from the provider subcommittee.
Any questions?
Just a comment that I think, so I was aware that there was a request for some more discussion regarding the proposed value-based payment approach. And that does seem like conversation that is more well suited to the rate reform subcommittee. So flagging that and might want to coordinate there.
Yep.
Thank you, Mallory.
Thank you.
So with that, let's move on to the rate subcommittee. Amanda, are there any updates from MainCare around rates? We did share a link to the monthly update in
Okay.
material.
So I guess I could just call out a few changes that happened after the monthly report on May 21st. The Section 23 Child Abuse Evaluation Services rate determination was completed. The comment summary and the final draft rates have been noticed and posted to the rate system reform website. And then we have scheduled the hospital forum for June 11th. And we did initiate a rate determination process for certain Medicare covered family planning services and long-acting reversible contraception for LARCs. And then I'll just note that we've started sending out the July 1 COLA notices. That's really all I have.
And that could be your question.
Thank you. Any questions? All right, Laura, it's up to you.
Hi, everyone. We did have our rate subcommittee, or I should say rate system subcommittee meeting on June 3rd. So just yesterday, because we did not have a meeting because of the Memorial Day conflict in May. Our next meeting, and I'll put these in the chat, is Monday, June 24th. So back to the traditional last Monday of the month at 2 p.m. And then we're also holding a special meeting with Olivia Alford from OMS to talk about alternative payment models and value-based payments. And it's a joint meeting with the provider subcommittee. This will be on the 27th, so Thursday afternoon, June 27th, from 3 to 4 p.m. And everybody is welcome to this meeting. So I will send out the calendar invite to all of the MAC. Please feel free to share it with your networks. And I'll be talking with Olivia a bit more to see how best to use that hour. Michelle very much noted the HCT comment and, putting that back with the rate system subcommittee, but certainly having the joint conversations around alternative payment models makes a lot of sense. For both committees to be engaged in that work. At our meeting yesterday, we continued to talk about planning for the rest of the year, and we are looking at, we have a schedule of our meetings. We're taking August off, but we have the special meeting at the end of June. And then, a lot of our conversation continues to be around the whole rate setting system. And as we're 2+ years into that, looking at a way to get feedback about the system from all providers and identify any ways to improve it, whether that includes, just conversations internally or looking at statute and making changes in the next session. Those are the types of conversations we hope to have this fall. And there's been an ongoing request to understand where the state is at within that overall initial 5-year period, looking at all of MaineCare rates and the determination and what maybe is left to do, and then moving forward, how it is that we all understand a 5-year cycle. Is that when the rate determination starts? Is it when the rate is proposed and done in rule, or when the rate is then effective and available to folks? So we had that discussion. We know the department is looking at that as well, but I think comprehensively through the committee and then the larger provider community, just understanding, I used the example yesterday of targeted case management, section 13, had a rate study a few summers ago, but if I'm a case management provider, when do I look at that projected 5-year period? Is it when the rate study started, or when the rate became effective, or some other factor that the department's looking at? So we'll look forward to continuing those conversations. I'll put the detail in the chat. We welcome everyone or anyone to these meetings. Please feel free to forward suggested agenda items, and I'm happy to add anyone to our email list. Thanks.
Thanks, Laura. Any questions? And Laura, we could talk more about this if it's helpful, but it might be a good conversation for the rate subcommittee too, to think about a vice chair so that in the event that something were to change, there could be more easy transition.
100% agreed.
Thank you. And then next up is dental subcommittee updates, and I can share those. I think the biggest update for this meeting is that we have settled on a new date, a new day of the month and time for our standing meetings, which we've been trying to figure out. And so that's going to be the second Wednesday of the month at noon. So that means it's June 12th this month, and I'll put the information in the chat in a minute. And Courtney Pladston from Main Care will also be joining, will be becoming a member, like a joiner of that committee, not member of the subcommittee, but joining on behalf of OMS. I would say, I think we continue to have a lot of the similar conversations we've been having for a long time about the ongoing challenges around access to providers, and in some cases, specific types of providers where there's hardly any that accept Main Care, and in some cases, just providers overall. And the overall, like we had a little bit more of a conversation at this last meeting, which I think I also shared in our previous SMAC meeting about this, but it's an ongoing conversation of trying to figure out like what are the things that live within Main Care, which can be affected by Main Care in terms of access, and what are the things that don't in terms of workforce or other challenges, and figuring out like how those intersect and what makes sense to be in that subcommittee versus we can't fix everything in that subcommittee because of the nature of what it is. So, and there are other groups also meeting to talk about a lot of these issues, including an ongoing subcommittee of the Maine Dental Association, and work within the CDC and work within the Children's Oral Health Network. So just trying to figure out like where all those things intersect and where specifically things land within Main Care in order to lift those up for more action. Any questions? And I'll share the information about the new monthly meeting. Okay, great. And so next up is the rulemaking packet. And I think, Kristen, you're doing it again this month.
I am. Thanks, Kathy. Just two minor updates for folks this month, flagging that our Section 29, Chapter 3 rule, which is support services for adults with intellectual disabilities or autism spectrum disorder, is finally adopted. As folks are probably aware, that is a major substantive rule, so it did need to go through the required 30-day period after filing, and so was officially adopted as of the end of last month. In addition, we did just file, also at the end of last month, our proposed rule for Section 43, Chapter 2, which is hospice services. And so for anybody who is interested, that hearing is scheduled for the 17th of this month, and the comments are slated to close on the 28th. So please join and comment as it relates to your organization or if it interests you. And that's really all we have for changes this month from OMS side. Any questions from anybody?
One question or one comment, just a thank you very much for looking into Section 23 again on further issue or further sections within further services within Section 23. Much appreciated.
Absolutely.
Any other questions or comments? Okay. Well, that brings us to our last item, which Mallory mentioned earlier, which is that currently Mallory is the vice chair of the MAC, but she will no longer be in that role as of the end of this month. And so we do need a new vice chair, and I haven't heard from anyone. I apologize if I missed something, but I haven't heard from anyone who's expressed an interest in that. So I would ask again for folks to consider if you'll be willing to be the vice chair. The biggest lift is if I have to miss a meeting, then you would facilitate the meeting, which doesn't happen super often, but does occasionally happen. So it's not a huge undertaking, but a necessary one. And we don't have a meeting in July. So if somebody expressed an interest before our meeting in August, then we could have a vote in August, and make that official. So putting that out there, I will put it out there by email as well as a reminder. And we'll let folks know if we do get anyone who steps up and says they're interested. Any questions about that? Okay. And then I mentioned this for the rate subcommittee, but also for the dental subcommittee, we'll talk about having a vice chair for that as well. So that we have a backup. And I think that is everything on our agenda. Let me just flip screens again. So I just said this, but a reminder, we do not have any meetings in July or this meeting in July, and we will reconvene in August. Thank you all.
Bye.
Thank you. Thank you. Bye-bye.
Thank you. Bye, everyone.
Thank you. Bye-bye.